Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! So, in this video, I'm going to share with you my favorite pharmacy apps. Now, these are apps that I used during pharmacy school. I'm currently using these apps while I'm completing my oncology pharmacy residency, and I'm definitely going to be using these apps even after my residency. Now, what I've learned over the years is that as a pharmacist, you get a lot of drug information questions. Now, it's impossible to have an answer to every single question, but it's very important that you could easily find where the answer is. So, having these apps on your phone is very crucial. It allows you to simply go on your phone, open the app, and find the answers to the questions you get. So, make sure you stick around for this video. You don't want to miss out. App number one, iPHONE. Now, I love this app. This is probably my favorite app. And I love it because it provides you information on medications, diseases, along with clinical decision tools that are created by clinicians. Now, one of my favorite features about this app is the fact that it does not require internet access. Now, where I practice, the pharmacy is located in the basement. So sometimes when I'm in the basement, I don't have any access on my phone. So, being able to go into my phone and use this app to answer drug information questions, even when I don't have any internet access, is pretty helpful. Now, they have a free plan and also a subscription plan. The subscription plan is $180 a year. $180 a year. I mean, it may not seem like a lot for some people, but for me, I'm definitely not paying that much. I probably need to go take out a loan from Sally Mae in order to pay this. Trust me, you don't need it. All you need is the free plan. Now, here are some of the features. Drugs search. It provides drug prescribing and safety information, so you could literally search any prescription drug or OTC, and it's going to provide you information on indications, adult and pediatric dosing, adverse reactions, contraindications, and pregnancy and lactation considerations. It even provides information on pharmacokinetics, pharmacology, and also provides you with a picture of the medication itself. Another feature is the formulary feature. This allows you to access healthcare insurance formularies in order to determine if a specific medication is covered, and also if there's any co-pays associated with it, the quantity limits, or any prior authorization requirements and alternatives. Now, this is very, very important, especially for me since I mostly practice in an outpatient clinic. I get to interact with a lot of patients, and a lot of patients are, taking, home medications, and you're discharged on certain medications, and they come to the clinic, and let's say they weren't able to get the medications. So I'm able to use this feature to look at the insurance to determine if there's any other alternatives for the patient. They also have the pill ID. So this allows you to identify and verify drugs by imprint, color, and shape. And as a pharmacist, this is a tool you definitely want to always have on your phone that you could easily access and, use it to verify, pills or capsules or whatever the case is. Drug interactions, right? Pharmacists, that's all we do all day. We identify clinical significant interactions between medications. And in this case, you could identify interactions between prescription and oral OTC drugs. What I love the most is that not only do they tell you there's an interaction, but they also give you recommendations on how to manage it. Next, they have a tables feature. Now, these tables provide information on a whole lot of different topics, right? So this include examples such as ACLS protocols, drug class comparisons, vaccination information, drug dosing equivalents, dietary reference intakes, and many, many more. The tables are really, really good. They have a lot of information on there. You'll be surprised. You might be looking for something. Go to the table section. They probably have it there. Calculators. So they also have access to dosing calculators, medical equations, risk scoring systems, right? So when you calculate a patient's risk based on different factors, right? So like the Chad Vask score, for example, They also provide information on infusion rates, dosing conversions, and many more. Other features include evidence based guidelines, notifications, and updates on practice change and news. And that's one of my favorite features, actually, the notifications. So, first of all, when you first go into the app, this is exactly what you see here. But before you see this, they usually provide you something like this. It's usually much longer than this, but I just cut it shorter. But they provide you information on any updates in clinical practice, right? Whether a new medication was approved, any changes to the guidelines, or whatever the case is. So it allows you to, be updated in terms of, what's going on in clinical practice. Here we have the medical equations here. And this is just, a few of them compared to the amount of medical equations they provide you with. Some of the ones that stand out to me automatically is the first one, the absolute neutrophil count, which is something I use a lot in the oncology clinic. But they have really good ones. Another one that I really like is the amikacin level prediction from the maintenance dosing. These tables that I was referring to may provide you information on things like these, right? So in this case, NSAIDs subclasses, right? And you have the different types of NSAIDs here for you. So this is the formulary feature where you select a specific medication, you select a specific insurance, and then it tells you if this medication is covered. And it's also able to provide you information regarding copays, and those kind of things. The tables can also provide you these kind of information right here, like medication comparison. So in this case, insulin comparisons, right? They have other tables that have, medications of the same class, and they provide you information regarding each one, right? Why you would choose one over the other, which is very important as pharmacists for us to know. Now, the drug interaction check, which is one of my favorite parts, as I mentioned earlier. So here they have two interaction. They have an interaction between two medications, Bactrim and warfarin, but they also provide you information on, how to manage it, right? So in this case, you want to use an alternative or just simply monitor the patient's INR. My next favorite pharmacy app is Sanford Antimicrobial Guide. Now, this is an app I discovered about 3 years ago during my acute care rotation. And one of my classmates actually had it in the physical copy of it, right? It's a very small book. It's like pocket size. You could simply just put it in your lab coat. But for me, I wanted the app, so I went searching and I found this. Now, this is the basically the specialized app, right? The specialized resource for any anti-infectives, antimicrobial. This is where you want to come to, okay? It provides information on infections, pathogens, and different anti-infective agents. It does not require internet, right? So once again, I love that about this app. And there's no free plan, unfortunately, but it's only $30 per year. And each year, once you pay the subscription fee, they update it with new information about everything in the app, really. Now they have different features. Some of the features include syndrome/diseases section where you're able to select a specific infection based on the site, right? So whether it's respiratory, GI, skin, whatever the case is. Then they have the pathogens section where you're able to select a specific pathogen. And what I love the most is that once you select this specific pathogen, it's able to provide you with common infections that are caused by this pathogen. Next, it provides you information on the medications, right? So characteristics about the medication, antimicrobial spectrum, known resistance, adult and pediatric dosing, dose adjustments, adverse effects, pharmacology, all that good stuff, including drug interactions. So it's like it's like a monograph, right? But in this case, it's specifically for antimicrobials. Prevention. This is a section that provides you information on like vaccine schedules, pre-procedure prophylaxis, transplant, post-exposure prophylaxis, etc. I don't use this feature that much, but it's still there for you guys. This may come in handy for some of you. So, just keep that in mind. They also have a tables feature, and for them, it's not as diverse. And it just provides information on like pregnancy risk categories, inhaled anti-infectives, renal and pediatric dosing for medications, pharmacology tables, and many more. Then they have the tools and calculations feature. So you're able to, compute different calculations. So one of my favorite ones is the creatinine clearance calculation. I use this all the time. Whenever I need to calculate creatinine clearance, I use this calculator. It's so easy. I'm going to show you a picture on the next slide, on the following slide, not this one. But yeah. So when you first go into the app, this is exactly what you see here. You have the different sections here for you. So let's say you select a specific pathogen, right? So in this case, we have E. coli. And what I love the most is that it provides you with some of the most common, right, sites of infection and some of the, agents or medications that work very effectively against this pathogen. For the medications, they also provide you with the spectrum of activity. So, which organisms does this medication cover? And they divide it into two. So, the recommended organism that it covers. So, this is where the agent is probably the first line therapy for these organisms. And they have other organisms in the active section, which basically means that this medication is going to show some kind of activity for these organisms also, but it's not like first line in that case. Now, here's the creatinine clearance calculator that I was referring to. As you can see, it's so easy. And what I love the most is that I don't need to determine whether I want to use IBW, adjusted body weight, or, using the patient's actual body weight, right? I just put in the patient's age, right? I put the patient's height. I put the weight, right? I put the patient's regular weight and the serum creatinine. And the app itself is going to determine if it's going to use the patient's IBW in order to calculate the creatinine clearance or not. Next, they have a pharmacodynamics section in the tables that I mentioned earlier. As you can see, it's pretty helpful also. It helps you determine, how these antimicrobials kills the bug, right? In what ways is it very effective? Do you have to give a high dose but less frequently, or do you give less doses but more frequently? In the table section also, they also have the different drug interactions. And these are like very important drug interactions that they've chosen. So they don't have every single drug interactions here, but all the drug interactions that are listed here are pretty significant. The next app is the Smart Medical app. Now, this is an app that I just started using, I would say beginning of this year. And this app provides you information on medications and lab values. Now, is the lab value feature is the main reason why I love it. And it does not require internet access in order to be used. Once again, that's like one of the best features of all these apps. It requires a one-time purchase, but it's only $9.99, so it's pretty affordable. You just make a one-time payment. You don't have to worry about it ever again. So here are some of the features. They have a section that provides you with test and lab values, right? So over 375 laboratory tests that are organized based on the body systems. So this is so easy because it allows you to automatically go to, let's say you're looking for a liver panel, right? You go to the liver, you select that as the organ, and it provides you with, different labs that are typically done for patients who are having some kind of, liver damage or whatever the case is. Anything associated with the liver, they will provide you information on that in that case. They also have drug monographs. I don't use this app that much for the drug monographs. My go-to app for the drug monographs is simply Hippocrates. Doesn't mean that this app doesn't have good information. It does have great information also, but I'm just more comfortable with the Hippocrates app for the drug monographs. For the test and lab values, I definitely like this app more though. They also provide you with medical calculators, and these medical calculators allow you to calculate creatinine clearance, anion gap, things like the Child-Pugh score, gentamicin, extended interval dosing, Karnofsky performance status, phenytoin drug levels, etc. So as you can see, it's very versatile, and they have a lot of different medical calculators in this section that will definitely help you out. Next, they have medical terminology. So these are different terminologies and their meaning. And this comes in handy, right? Because sometimes I'll be reading like a doctor's note and I'll see a term that I don't really understand, I'm not really familiar with. So I could easily go into this app and search it out. And it helps you understand the terminology also, right? So being able to understand like the medical roots, the prefix, and the suffix, which is, once you understand these two, it's used a lot for a lot of the terminologies. So it's just going to make everything so much easier for you. They also have an English and Spanish dictionary, and this provides is an effective, fast, and convenient reference for medical words in both English and Spanish. And it allows you to translate between terms. And I actually use this feature a lot simply because the hospital that I practice at, our patient population are mostly Hispanics. So, everybody there is like trying to learn as much Spanish as they can, in order to effectively communicate with these patients. So having this feature on this app is very, very helpful for me, and I use it a lot. So here are some screenshots of this app. So when you first go into the app, you see this here. As you can see, it has lab values, drugs, tests, and procedures. Now, as a pharmacist, you may feel like, okay, I'm a pharmacist. Why should I worry about tests and procedures? That's mainly for physicians when you're diagnosing. Yes, that is true. But just because you're a pharmacist does not mean that you shouldn't know what an echocardiogram is, right? It's a small piece to a huge puzzle. And knowing that is gonna help you become a better clinician, right? In order to become a more effective pharmacist, you must know how to, speak the language of a physician. So understanding these different tests and procedures is definitely gonna help you achieve that. They have different calculators, the medical terminology, as I mentioned, and information on diseases. The information on diseases actually links you to like a website. So I don't usually use it that much, but you should definitely check it out also. Here is the labs. Okay, so you can select a specific, lab test, and they provide you with like the reference range. They give you some description about the lab specifically and why it's significant and when to use this specific lab. So that's why I really like it. So in this case, they're telling you when it's gonna be increased. So it's pretty cool, right? It gives you like a whole understanding of the lab itself. So you don't only know the numbers, but you actually know the meaning of the lab itself. So here is the drugs feature where you type in a specific drug and it provides you information on this drug. Here are the different lab panels, right? As you can see, the way it's organized is so easy, right? You could just simply go to CBC and it provides you all the information you need, right? Or arterial blood gas, etc. I really love how it's so organized, whatever I need, I just come in and I find it so fast. Here they provide you with some tests, right? Echocardiogram. They give you like common indications. And no, as a pharmacist, you definitely don't need to know every single one of these. But as I mentioned earlier, it's just a small piece of the puzzle, and just knowing these things is just it's gonna help you understand everything as a whole, right? It's gonna make it so much easier for you. They give you a little description about the test also, so it's pretty cool. And here are some clinical calculators, right? Some calculators that allow you to, utilize different things to determine a patient's risk of, developing something or prognoses or whatever the case is, So they have different versions of these. Now, the last app is GoodRx. Now, this app is one that every pharmacist should have. Now, during my residency, my director told me one thing: no matter how smart you are as a pharmacist, If you cannot provide the medication for the patient, then I mean you're pretty useless in that case, right? So at the end of the day, physicians really appreciate us for being able to provide the medications for the patient, right? Because we're using these medications to treat the patients, save lives, They diagnose the patients and now they need the medications. So if you're able to provide these medications for the patients, you're definitely helping them, and they'll love you for that, of course. And I'm saying this because this app allows you to, keep track of medication, drug prices, and also offer drug coupons. A lot of medications, even after the insurance covers it, there's still a high copay, and sometimes the patients cannot afford. So having this app allows you to, track these drug prices and offer drug coupons to patients. It doesn't require internet access once again, and that's why I love it. And it's free, so you don't have to worry about making any payments. You simply just have to download this thing. Now it has great features. So some of the features is, being able to just simply search for a medication and, finding coupons, right? And they give you specific pharmacies around you, like pharmacies around your location that you could go into to utilize this coupon. And this comes from close to 75,000 pharmacies. You're also able to, save up to 80% on a prescription, right, from these coupons. And these coupons could be also saved and shared via text or email, right? So you could simply email these coupons to a patient if that's needed or to a physician. You could also save a prescription. So let's say you search a prescription, you can actually save it, or the patient could save it, and this allows the patient to track prices, receive any savings alert, and also refill reminders, which could be very, very important for patients who are non compliant. Medication info feature. So this feature basically provides you with like a drug monograph, right? That provides you information on the proper use of the medication, dosing, storage, drug interactions, side effects, etc. I don't usually use this, but it really has accurate information in this section too. I definitely verified it. It's very nice to have in the app. Like I said, I don't use it that much, but you could also definitely check it out to see if it's helpful for you once in a while. So here are some screenshots of the app itself. So when you first go in, this is what you see on the screen. Then you type in the medication that you're interested in. Now, then you are able to select the strength and also the quantity. And the quantity is very important because, if let's say the patient wanted, refill reminders, this is how they're able to get that based on the quantities. And also you're able to select exactly where you plan on, utilizing this coupon, right? So if it's near your current location, or you could pick a different location if let's say you're looking for coupons for somebody else. And once you select this, you're able to see the different options in terms of pharmacies around your neighborhood and the coupons, right? So you get different coupons here. And as you can see, some of them is much higher than others. So this app is very, very effective in terms of like providing patients with, coupons that will allow them to save and be able to obtain their medications. Once you get the coupon, this is exactly how it looks like. It provides you with all the information that's needed. And you simply just have to show this to the pharmacist, and that's it, right? And the patient will save the money here, right? And you're able to save this coupon also. Now, this is the drug monograph section, as I mentioned earlier. They provide you with a lot of information. There's information here that I may not be able to find in Hippocrates, so it's very effective. I think you should still use this feature here. Whenever you feel like you can't find something somewhere else, you could come in here and check it out. Excuse me, and you might be able to find it. And guess what? They also have a pill identifier feature. I don't use it that much, but I know that for whatever reason, if I can't use Hippocrates, I could always come here in order to get the pill identifying information that's required for me to verify the medication. And that would be the end of this video. If this video was helpful, make sure to like, comment, subscribe, and share with someone who can benefit from it. As I mentioned earlier, these apps are beneficial for pharmacy students, postgraduate students, any pharmacist who is currently practicing. These apps will definitely help them also. And make sure to try these apps out. If you don't want to get the ones that require you to pay, that's fine. But at least get the free ones, right? Get the free ones, download it, put it on your phone. Even if you're not gonna use it right away, just have it there, just for one day. If you ever, come across a question that you need to answer on the spot, you can simply just go on your phone and answer it. Trust me, this will make your life so much easier. Like I mentioned earlier, pharmacists, we get a lot of questions from both patients and clinicians. So it's really nice to have something you could easily open up on your phone to get these answers. So that's all for today. I'll see you all in the next video. Take care.